Welcome, everyone. We've got several registrants and who we are waiting to attend. They haven't come in yet, but I think we are ready to start. Uh, so today we are having a on part of the Abot Kamay online series is is a webinar on the vaccines. Uh, Presently, we know that what the present problem that we have right now, and we are wanting to get into the question of uh, the myths and how to access the vaccines. So today we have prepared this webinar in order to inform people about vaccines as well as the methods and processes of accessing them. And this is especially for people who are marginalized because of their situation, meaning uh, they are more vulnerable or have a harder time accessing the services. This includes our seniors, as well as migrant workers, especially temporary foreign workers and undocumented workers. So, uh, before we start, mm, I would like to inform everybody that we will be live streaming this webinar on Facebook at the Migrant Facebook page. And so, if you are uncomfortable about having your name or your picture in it when you ask questions, you could keep your video off. And we suggest that questions should be put in the chat or in the Facebook comments for our technical persons to actually gather and collate and present to the speakers after they make their presentations. So we will be asking all to please mute themselves. That way, everyone would be able to hear the presentations very clearly. And also, we will be having a group picture probably at the end. And if you are not comfortable, just with a picture going, taking your picture, we just shut down your video and you can do that. First, before we start, we would like to acknowledge that we are organizing, living, and working on unceded Coast Salish territories, specifically of the Musqueam, the Squamish, and the Tsleil-Waututh nations. We thank them that we are able to do all this in their territory. So, again, magandang hapon po sa inyong lahat. Good afternoon. Welcome again to the Abot Kamay online series for those who have just signed in. This is a project of Migrante BC. And I am Chando Claver and will be your host for this session. In the last 1.5 years, we have had the experience of this deadly scourge of a viral epidemic. By now, each one of us has probably experienced a death or serious illness on one or more of our relatives and friends. The most affected have been our seniors, especially those with comorbidities, and migrant workers, especially temporary and undocumented workers who need to go to work despite the threat of the pandemic. These are our marginalized and very vulnerable sectors that need our attention. Now, in the last several months, a potentially potent answer to the scourge of the pandemic has been presented in the form of vaccines. But what, what are these vaccines? What are they? Are they safe? Should I get myself vaccinated? How do I get vaccinated? Will they actually vaccinate an undocumented worker? These questions have cropped up due to our past experiences, most of them bad or some of them good, as well as because of the endless vaccine chatter in social media, ranging from the correct to the bizarre. So today, we have invited two speakers to try to shed light to those questions. So before we start, we acknowledge the support under the stipulated conditions of Migrant Workers Support Program and the Government of Canada and of MOSAIC. So let me now go forward and introduce the speakers. Uh, Sheryl Anne, our first speaker, Sheryl Anne Montano, holds a honorable BSc Bachelor of Science in Human Biology and Nutritional Science from the University of Toronto, and a Bachelor of Science in Nursing Science from the University of Montreal. She's currently working as a COVID-19 vaccinator and as a pediatric nurse clinician. In addition, she's also a volunteer of Pinay, Quebec, which offers support to vulnerable Filipina domestic workers. And she is also a member of the Center for Philippine Concerns, which is a network of individuals committed to strengthening solidarity ties between Canadians and the Filipino people. Her presentation is entitled Debunking COVID-19 Vaccine Myths. So before she starts, just a reminder, there will be a Q&A, a question and answer forum at the end of the second speaker. Please feel free to write your questions in the chat box or in the Facebook comments. So now, please welcome Sheryl Anne.
I'll just share my screen. Hold on. Can everyone see my screen?
Yeah, we can see it.
Hi, everyone. Thank you all for tuning in tonight. I know these days you're all probably inundated with COVID-19 related information. I hope that this webinar will help with all the confusion about the vaccines. I don't have all the answers, but I'll try my best to communicate with you the facts that are available up to date. So I'll start with the disease itself. What is COVID-19? You all probably know this already. You've seen this image on TV or on your social media news feeds, right? So COVID-19 is an infectious disease caused by the coronavirus SARS-CoV-2. There are hundreds of coronavirus, such as the one that causes the common cold, but this one is among the few that can cause more serious and fatal disease. Why is it called coronavirus? Its name comes from the crown-like structures on the surface of the virus, which are called spike proteins. So remember this. And it's these spikes that allow the virus to stick to and get inside the cells of our bodies and make us sick. The virus spreads from an infected person to others through respiratory droplets and aerosols, so smaller droplets, created when an infected person talks, sings, shouts, coughs, or sneezes. The symptoms of COVID-19 are similar to other respiratory illnesses like the flu and the common cold. So the symptoms of COVID-19 can range from mild to severe. Sometimes people with COVID-19 have mild illness, but their symptoms may suddenly worsen in a few days. The most common reported symptoms are fever, cough, fatigue, and loss of taste or smell. But some people also develop sore throat, headache, nausea, vomiting, body aches, and pains, as well as skin rash and discoloration, and even diarrhea or red eyes. The more serious symptoms include shortness of breath, difficulty of breathing, loss of speech or mobility or confusion, and all of these require immediate medical attention. So these symptoms may take up to 14 days to appear after exposure to COVID-19. And it's also possible that you never develop any of these symptoms at all, but you can still infect others. If you think you have COVID-19 symptoms, you can use this online self-assessment that's available on bc.thrive.health to decide if you need further assessment or testing. And it's very important that you self-isolate while you wait for your test results so you don't potentially spread COVID-19 to others. So most people recover completely within a few weeks, but sometimes the COVID symptoms can persist for months. Older people and people with many serious medical attentions are the most likely to experience lingering COVID-19 symptoms. But even young, otherwise healthy people can feel unwell for weeks to months after infection. So the common signs and symptoms that can linger over time include fatigue, declining quality of life, joint pain, shortness of breath, memory, concentration, or sleep problems, and even anxiety and depression, brain fog, and headaches, blood, blood clots, and chronic kidney problems, and as well as hair loss. As you can see, it can really affect multiple organs of the body. In fact, a study found that about a third of hospitalized COVID patients develop these long-term conditions. So how do we combat this disease? Thankfully, we have vaccines available now. These are the available vaccines authorized in Canada: the Pfizer BioNTech, the Moderna vaccine, the AstraZeneca Covishield, and the Johnson by Johnson and Johnson. So essentially, a vaccine works by training our immune system to recognize and fight pathogens, either viruses or bacteria. In COVID's case, the pathogen is the coronavirus SARS-CoV-2. So in Canada, for a vaccine to be authorized, it must go through a very rigorous process. And normally this can take even decades and cost hundreds of millions of dollars, because how urgent the situation is. This is a global pandemic, right? There was a global concerted effort on making these vaccines available, and they really prioritized the resources for its development, and that's how they were able to fast track the process. But that does not mean a compromise on the vaccine's safety and efficacy. So each vaccine still needed to pass the rigorous scientific standards of Health Canada in order to be approved. And even if it's already being rolled out, there's still an ongoing monitoring of its safety. So the first two vaccines made available in Canada are messenger RNA vaccines, so the Pfizer and Moderna vaccines. So how do they work? When a person is given this type of vaccine, their cells will read the genetic instructions contained in this vaccine like a recipe and produce the SARS-CoV-19 spike proteins. Remember those proteins? The cell will then display these spike proteins on its surface. And then our immune system recognizes that this spike protein does not belong there and begins building an immune response and making antibodies. These antibodies help us fight the infection if the real virus does enter our body in the future. So the Pfizer BioNTech vaccine is an mRNA vaccine, and this vaccine is given by an injection into the muscle of the arm. For the vaccine to work best, you need to get the 2 doses. So a single dose and then a second dose 21 days later according to the manufacturer, but the BC government extended the interval up to 16 weeks, so 4 months. So your immunity then develops over time. It takes about 2 weeks to develop significant protection against COVID after injection. So for the greatest protection, you really need to get the second dose. So clinical studies showed that beginning 1 week after the second dose, the Pfizer-BioNTech COVID vaccine was 95% effective in protecting participants against age 16 and above against COVID-19. And it's found to be 100% effective in participants 12 to 15 years old. So the second mRNA vaccine that's available is the Moderna vaccine. It's given by the same method as Pfizer, so into the arm. For the vaccine to work best, you also need to get 2 doses. The manufacturer recommend a 1-month interval between the 2 doses, but again, the government extended it up to 16 weeks. So based on studies, in about 30,000 participants, the Moderna vaccine was found to be 94.1% effective after the second dose. So the next type of vaccines are the viral vector vaccines. And so instead of using mRNA to produce spike proteins in the case of Pfizer or Moderna, these vaccines use a harmless virus, so not the virus that causes COVID-19. It's really a weakened modified virus that's delivered to your body, and that's called a vector. And once this vaccine is injected to your muscle, it will trigger your immune system your cells to produce the SARS-CoV-2 spike proteins. So how does it work? First, the vector, not the virus that causes COVID-19, will enter a cell in our body and then use the cell's machinery to produce a harmless piece of the virus that causes COVID-19, so the spike protein. So this piece is only found on the surface of the virus, and that's the one that piece is the one that causes COVID-19, right? So next, the cell will display the spike protein on its surface, and then our immune system recognizes that it doesn't belong there. This triggers our immune system to begin producing antibodies and activating our immune cells to fight off what it thinks is an infection. So at the end of this process, our bodies have learned how to protect us against future infection with the virus that causes COVID-19. The benefit is that we get this protection from a vaccine without ever having to risk the serious consequences of getting sick with COVID-19. Any temporary discomfort experienced after getting the vaccine is a natural part of the process, and that indicates that the vaccine is working. So one of the available viral-based vaccine is the AstraZeneca Covishield vaccine. This vaccine is given by, again, 2 separate injections into the muscle of the arm, and the recommended interval is 4 to 12 weeks. But the government extended it up to 4 months. So this vaccine has been shown to be effective for about 62% beginning after 2 weeks after the second dose. And the second viral vector-based vaccine is the Janssen by Johnson & Johnson. It's the only single-dose vaccine that's available. So based on studies in about 43 100,000 participants, this vaccine was 66% effective in preventing the symptoms of COVID-19. So what are the common side effects of the vaccine? So I've experienced some of these when I got the Pfizer vaccine, and they didn't last for more than 36 hours. So here they are. The most common is pain at the site of the injection, and you can also get painful swollen lymph nodes in the arm where the vaccine was injected. You also can experience tiredness, headache, muscle or joint aches, nausea and vomiting, fever or chills. But these are common side effects of vaccines and do not pose a risk to health. So they shouldn't last for more than 2 days. There's also a risk of severe allergic reactions, but they're very, very rare. As for AstraZeneca, Covishield, this vaccine you probably heard in the news has been associated with very rare blood clot events. So it happens about most recent data is 1 in 60,000 people. So up to today, there have been 28 cases, but that's 28 cases out of over 2 million doses administered. So what are the symptoms to look for a blood clot? So the blood clot events were reported between 4 to 28 days after the injection, and the symptoms of a blood clot that you can look for are persistent and severe headaches, vision changes, seizures, and other symptoms that resemble a stroke, such as weakness or numbness of the arms or legs, shortness of breath, abdominal or chest pain, swelling and redness in a limb, and pallor and coldness in a limb. So if you have any of these symptoms in that period, so 4 to 20-day period, it's really important that you seek immediate medical and attention. Oops. So I just want to mention that, like I said earlier, in the long-term effects of COVID-19, there's a risk of blood clot when you contract the coronavirus. So it's the risk of developing a blood clot is actually 8 to 16 times higher when you get COVID rather than getting the AstraZeneca vaccine. I just wanted to mention that. So one of the ways we can combat this global pandemic is achieving herd immunity or community immunity. It's when a large part of the population of an area is immune to a specific disease. So it's achieved when most of the population is vaccinated or infected by the virus, but it's very unethical to infect a population naturally, right? With a virus, like we've seen a lot of death in the past year, so we're not gonna achieve herd immunity naturally. We're gonna achieve it by vaccinating the population. These are some of the myths that you probably heard from the media, from your entourage. So, oops, sorry. So the one of the common myth about the vaccine is does it alters your DNA? That's not true at all. So once you're vaccinated and your body produces the spike protein, the DNA, the mRNA is destroyed by your body. So also the mRNA does not enter the nucleus of our cell and thus cannot change our DNA. And another myth is about the vaccines is it's not safe because how quick it was rolled out. But like I explained earlier, there was still a thorough and rigorous safety standards and trials that were met. Next myth, food allergy, immunocompromised, breastfeeding, or pregnant people can't get the vaccine. That's not true. All these people can get the vaccine, and I did vaccinate many of them lately. And another myth, you can get the COVID-19 from the vaccine. Again, that's not true. The vaccine cannot give you the virus. It protects you. So it teaches your immune system how to produce the antibodies that will later protect you when you do get infected by COVID-19. So I've had another myth. I've had COVID-19, so I don't need the vaccine. Right now, we don't know how long the immunity, natural immunity, will last. So it's still important to get the vaccine to fight the reinfection. Another myth: there's no need for mask or social distancing after vaccine. Like I said earlier, it takes a few weeks for the vaccine to work, and none of them are 100% effective in protecting you against the disease. So you must still take the precautions to help end the pandemic. So there we go. Until we achieve herd immunity, until everyone is immune to the vaccine, we still need to continue to practice the public health recommendations. We need to continue practicing hand hygienes, stay home when you have you think you have COVID symptoms, and practice physical distancing. It's still very important. And if you need more information about the vaccines and the COVID-19 disease, you can check out the website of the Ministry of Health of British Columbia, or check out the website of Health Canada too. I found a lot of useful information there. Thank you.
Okay. Thank you very much, Sheryl Anne. Okay. Oh, another reminder that the question and answer will be done after the two speakers have spoken. Okay. So please feel free to write your questions in the chat box or in the Facebook comments. So our second speaker is Byron Cruz. Byron arrived in Canada. Hello.
Hello. Just a second. Yeah, I'm there. Yes.
I'll introduce you, Byron.
Yes. Okay. Thank you.
So our second speaker is Byron Cruz. Byron arrived in Canada 29 years ago, fleeing persecution for resisting inequity, injustice, and state violence in Guatemala. Currently, he is the organizer and outreach coordinator for Migrant Workers Program of the BC Federations of Labor. Actually, it's their occupational health center. He is also an active member of the Sanctuary Health Collective. Sanctuary Health Collective is a grassroots collective that gives direct support, advocates, and organizes with migrant families with precarious or no immigration status for access for all services based on need and not on immigration status. Byron organizes with the Migrant Rights Network in BC and the National Migrant Rights Network to raise awareness about the issue faced by migrant communities and to ensure that temporary farm workers and undocumented the communities have access to services and dignified working conditions. His own journey organizing to address justice and iniquities in Guatemala and his journey of immigration grounds his commitment to build a society rooted in inequity, racial justice, and dignity. So please welcome Byron Cruz. Hello, Byron.
Hello, thank you so much for this invitation. It is always a pleasure to be with you, to be with Migrante BC and the Filipino community. And yeah, great day today. I was busy working on the farms and taking some agricultural migrant workers to the clinics. And as you know, I am part of the BC Federation of Labor, the Health and Safety Center. My main role is in education about health and safety rights and responsibilities. And basically what I would like to bring today, it's a kind of a report back to the community in terms of what are we doing in terms of grassroots groups, in terms of being part of the Migrant Rights Network. Migrante BC is part of the Migrant Rights Network, the same as Sanctuary Health. And as a member of Sanctuary Health, a member of the collective Sanctuary Health, we have been working with undocumented migrants and other migrants with precarious immigration status since 2011. And it is always nice to organize together with Migrante BC to organize this kind of events, or also organize other events. Like if you remember that last year we had that great caravan organized in Vancouver. In terms of COVID-19, last year, as everyone remember, it was difficult at the beginning in terms of knowing what to do. In British Columbia, one of the first places or the first like work sites to be affected by COVID was a farm in the area of Kelowna, and quite a few Mexican workers were affected by COVID at that time. And since that time, since the first time, we knew that this was going to be continued, that this was going to be for a long time. We never knew that it was going to take so long, but we knew that it was going to be difficult situation. And as a result of the first outbreak in Kelowna, where many workers were affected, I think the British Columbia government learned some of the problems, and they learned also how to respond. I would say they responded in quite fast manner when we compare the situation with at federal level. As you know, in Ontario, COVID has affected the migrant communities in a bigger scale. Last year, more than 1,500 workers were affected by COVID in the farms. Also, 3 migrant workers from Mexico died as a result of COVID. As it was denounced since the beginning by the Migrant Rights Network and other groups, some of the historical problems in the farms, like the precarious situation on the farms, not enough space for the workers to stay in the farm, and also all kind of lack of access to health services and to other social services. All of this, plus the pandemic, it was the perfect formula for thousands of workers to be affected. And as a result of this situation in Ontario and Quebec, the federal government came with a guideline to the employers about how to reduce and protect, how to reduce COVID and how to protect workers from COVID. But as we knew, this was only a guideline, right? As guidelines, many people, many employers were not following the guidelines. And as a result of that, we had like thousands of people being affected and infected by COVID in Ontario. And later on, the federal government made some progress in terms of some changes to the guidelines, in terms of being more clear to the employers about the expectations in terms of employers having protocols at the farms, also in terms of the transportation of migrant workers in the farms, in terms of the distance between beds where working, where staying. And of course, as a guideline, it was not necessarily followed by all the farms. In British Columbia, the situation was a little bit better basically because the provincial government decided to start a quarantine process for every migrant worker coming to the farms. Then every migrant worker coming to the farm are, like, since last year, they have been going through a quarantine process in hotels in Richmond, British Columbia. 5 or 6 hotels have been used for this quarantine process, where the workers can stay up to 14 days. And also, in terms of the workers who somehow are diagnosed with COVID, then they might stay more days at the hotels. And all of this plan was developed by the provincial government in coordination with health authorities and some of the migrant agencies or groups. Then this year, last year, we realized that having the quarantine at the hotels was great in terms of being able to diagnose COVID on time when people came. I think it was around 68, 70 migrant workers who were diagnosed at the hotels, and they were treated by the health team at the hotels. The Vancouver Coastal Health and Public Health had presence at the hotels. Then people are taken care of. And but last year we also learned from the situation happening in the farms, basically during the months of November and December. We started to get phone calls from migrant workers who were feeling sick, and unfortunately, the supervisors and the owners of the farms were not taking them to proper healthcare services. or they were giving pain medication. That's it. And we decided to coordinate with other groups, and we called Fraser Health Authority, and we basically coordinated with Fraser Health authorities the first visits to the farms that were affected by COVID. Fraser Health Authority decided to conduct some massive testing, and yeah, there were quite a few farms that were affected during those months. And of course, all these questions came: who is going to pay me if I had to do quarantine? Who's going to pay me if I had to be isolated for these 10 days or 14 days? In some situations, or in many situations, migrant workers were not paid. In other situations, they were paid by workers' compensation. In other cases, migrant workers were paid by the employers, right? And then this year, again, we realized that it was going to be difficult for the migrant workers, especially because there was already presence of COVID in the farms. Then we decided to request the health authorities to provide or to make available the vaccine for everyone, or for migrant workers coming through the quarantine. And at the beginning, the government says, no way, we had to follow the strategy about age. And we knew that that was going to be difficult. Being affected by COVID is not fun. I can tell you that it's not fun. In December, I also became infected with COVID, and those days or weeks with high fevers and aches everywhere. All my joints were aching, my head as well. And I lost at that time 14 pounds. I gained those 14 pounds back now. But it was not easy, and my whole family got affected in December. And I understood how hard it was for the workers as well, because despite that, I can make a phone call and I can ask someone to please bring me some food to the patio, or to the closer to the door, or if I can ask someone to please go and get some Tylenol for me. But that's not the situation with the migrant workers. We realized last year that the protocols, the federal protocols and provincial protocols, were used in many situations against the workers, where the employers decided not to allow workers to be visited by any of the migrant groups, migrant rights groups. And actually, there were a few cases of workers being repatriated because they received the visit of a migrant group to the farm. And the owner realized about that, and they repatriated the workers. There was also a repatriation of a worker with COVID. And the situation was not easy, and workers were not getting enough food at the farms. We had to make some effort to bring food to many farms in coordination with churches. And finally, the federal government sent a letter to the employers saying that they could not limit the food to the workers. They could not limit the workers to go and do their shopping. But if they are in isolation, the employer is supposed to provide some support for them. Some farms did it, other farms did not follow that instruction. And this year, when we asked for the vaccination, it was because we realized that many farms were already affected by COVID. Having new workers coming to the farms, it was a formula for a disaster. Then finally, the provincial government made the COVID vaccine available for during the quarantine, and workers got AstraZeneca vaccine at the beginning. Later on, it was changed to a different vaccine, and all workers going through the quarantine at the hotels are offered the vaccine, and workers can also say, no, I don't want the vaccine, it's their option. And but of course, it's always difficult for a worker to make a decision. And we always say that an informed decision is the best decision that can be made, right? Then, but workers who decide not to have the vaccine, they can say, I don't want the vaccine. And workers who want it, they can say, I want the vaccine. Then most workers have been vaccinated at the hotels, but they were workers already in the farms in the Fraser Valley and Kelowna. And we had a discussion with the health authorities, and the health authorities decided to start doing vaccinations on the farms that had more than 50 workers. That was the first stage. These farms were visited by the health teams, and vaccinations were conducted, and workers also had the freedom to say, I don't want the vaccine. But of course, again, if you are in a group, you might feel that the social pressure that you have to have the vaccine. And we, in our communication as a migrant rights network, we always have been clear that we ask access to vaccines, but not to be mandatory. Like, access to vaccine is important, but it should not be mandatory for workers. More workers must have the decision, the power to decide if they want it or if they don't want it. Then many workers had the vaccine, other workers decided not to have the vaccine. Of course, this is a discussion that workers must have. Also, there is something that we will see what is the result of all of this. It's not mandatory, but at this time, we don't know yet what will be the result of not being vaccinated in terms of being invited to come next year or not to work at the farm. It's too early now to know what will happen, right? And hopefully the federal government and the provincial government can provide more guidelines to the farms about it. It is important to let everyone know that it's not a mandatory measure right now. And the first stage of the vaccine with those farms with more than 50 workers ended. Then my understanding is that they started the second round of vaccines to farms smaller than 50 workers. And let's see what comes after this. We are still waiting for the BCCDC plan or the provincial plan for the second dose. I have been asking for that plan, and I don't think there is a plan. And basically, the assumption is that each worker can register online, and they will be sent a text when to get the second dose. That will not happen. Migrant workers in the farms do not have a local phone number. They use WhatsApp numbers. Then it is difficult also to be in a remote place, and it's difficult to be allowed to go and have the vaccine in a clinic that is 2 hours away. Then a plan must be developed, and I really think that as a migrant right groups, we should keep asking the provincial government for clarification in terms of the plan to do the second vaccinations for those workers that want the second vaccination or the second dose. And in terms of some of the workers in other regions, like the islands, I requested some information. I couldn't get information, but many workers were not offered the vaccine in the island. Then the situation is different when it comes to migrant workers who do not have a status, undocumented migrant workers, or migrant workers with precarious immigration status. As we know, there are thousands of people with precarious immigration status. And the Migrant Rights Network sent a letter to the different provincial government asking to provide information about the plans to vaccinate people with precarious immigration status or no status. The only government that responded about this was the British Columbia government, that responded that access to the vaccine was for everyone, regardless immigration status. And they said that also people's privacy was going to be respected. They said that they won't share the information with any other agency, like Canada Border Service Agency, for example. Then as a Migrant Rights Network, we have a letter from the government reassuring that the vaccine will be available for everyone. The process, as you know, it's for someone who doesn't have medical services plan, is that they can still register for a vaccine. You just need to say that you don't have MSP. The government will create a personal health number. This is the provincial government. Then you can register. I'm just putting the information on the chat. You can still register if you don't have a personal health number. And there is a number there where you can phone and just you can actually ask for to speak in your language and Tagalog, and we can ask to speak in Spanish, and they're supposed to provide that multilingual support. And they will create a personal health number for you, and they will let you know when is your time for vaccination. We have tried that system. Very few people with precarious immigration status trust the line, and I completely understand why. And we are requesting the government to organize or to work with us as migrant groups to organize specialized clinics with our members and also with undocumented communities or communities with precarious immigration status. And so far, we don't have any positive response about that in terms of being flexible enough to work with us in organizing those clinics. Some interesting efforts came in terms of the vaccinations in the downtown east side. And these like undocumented people in the downtown east side were able to go to the vaccination sites, and they were able to get the vaccines. And there is okay, for undocumented workers, they can basically go, they can, as I explained, that they can register in that calling that number that I put on the chat, and you just have to say that you don't have MSP, and they will create a personal health number that is not an insurance, but it is a personal health number, and it's supposed to be protected. It's supposed to be private or confidential, and still nurses will ask for some kind of ID. Doesn't have to be a Canadian ID, can be another ID. And so far, I haven't seen anyone to be denied the vaccine. We will be still keeping asking the government for specialized clinics. Like I would like to see clinics organized in coordination with Migrant BC, in coordination with Sanctuary Health, in coordination with SWAN and all the migrant groups. And I think we should work in coordination, all these groups, and ask for a meeting with Dr. Henry and ask her to support us on this, because many people who are vulnerable in terms of migration status might not feel okay calling that number. But they will feel okay coming to clinics that we can organize because they trust us. Also, I know that there are some interesting initiatives in the downtown east side. They already organize clinics with the Chinese and the Vietnamese communities. Then we are asking for something similar. I also know that there is an effort from some of the settlement agencies in terms of organizing clinics to vaccinate government-sponsored refugees and refugee claimants. They already had some discussions with Vancouver Coastal Health. Hopefully they are successful, but we also would like to be part of having a plan for people with more vulnerable situation. And still all in conversations, but I would love to work with you and with other groups in bringing this issue to the provincial government and to the unions. That's it for now. Thank you.
Okay. Thank you very much to you, Byron. Mm,
Thank you, everyone.
am I having problems with my audio?
Yes.
May I remind you? Yeah, I think so. Okay. May I remind people again that they can put their questions on the Facebook comments, as well as in the chat section of this Zoom. So we'd like to open now the question and answer portion. But before we do that, I'd like to acknowledge the presence of Teresa Barrera of Omni News. So we do have media participating today. Welcome, Teresa. So we have a couple of questions to start off the question and answer. Let me check my list. So the first question is coming from Alda, and it's probably for Sheryl. Sheryl, I have a 13-year-old son, and his allergy is on amoxicillin. How safe is the vaccine for him? That's the question.
It should be safe. I've vaccinated people with many other severe allergies. So, but considering that he's 13 years old, I don't know if they've already authorized in BC. I know the Health Canada has authorized it nationally, and that it's they've done studies in kids, and the vaccines, the Pfizer vaccine has been found to be effective and safe for 12 years and above. So if there's an opportunity for him to get the vaccine soon, and you can go ahead and read about the study that was done in children his age. I don't see any contraindications that can prevent him from getting the vaccine, the Pfizer vaccine.
That's for the Pfizer vaccine for 12 years old.
Only the Pfizer vaccine, yes, that's available for 12 years and above.
Okay, but anything about AstraZeneca on the age limit?
All the other vaccines are, so the Moderna, it's 18 years and above, and as well as the other two viral base, vector viral base vaccine.
Okay,
So only the Pfizer vaccine is authorized 12 years and above.
okay. Another question for you again. Every time I do a flu shot, I had flu after. As of now, I can't decide if I will get COVID vaccine. Can I choose which Can I actually choose which vaccine?
I don't know the regulations or the rollout in British Columbia. I'm based in Quebec, but here you're allowed to cancel your appointment and come back when the vaccine that you want is available. But I like I said earlier that all the vaccines are um, effective, and most of them are 100% effective against severe symptoms of the COVID. So against hospitalization, 100%. So yes, that's there's no, well, there, it's very the benefits outweigh the risk of getting any type of vaccine, in my opinion.
Yeah, thank you very much. Yeah, for the information of most, in BC, right now, it's the pharmacies that give AstraZeneca, and it's the health authorities that give the Pfizer and Moderna. So, depending on how you want to schedule your vaccination, go to either of those sites. So there's a portal though, so you can access that too. So a third question, this now for Byron. Can undocumented migrant workers access downtown East Side vaccination centers?
Um, I
Yeah,
will
because
ask the question.
I think the
Yeah.
background, I think the background for this is because you said that there was this thing about the the downtown East Side doing things for the homeless who have
Yes,
basically, yeah.
yes. Anyone, any undocumented migrant or migrant with precarious immigration status who live in the downtown east side, they can access the vaccination that are programmed in the downtown east side. And most of these vaccinations take place at the Carnegie Community Center. But it's limited to the geographic area. People live in the downtown east side. We are asking to expand that geographic area. We sent a letter, but we are still waiting for a response from the government. Yeah, that's basically. And regarding the previous questions, the access to the AstraZeneca vaccine in the pharmacies, it can be possible, but you have to have medical services plan card because they charge for the vaccine to the MSP. Then in the other vaccination sites, MSP is not necessarily attached to the access to the vaccine. Anyone also, since last week, any pregnant women can access the vaccine regardless their immigration status. They can book their appointment through that number that I wrote on the chat, and they don't need MSP. They just need to register through that number, and they will be sent a date right away.
Okay, thank you, Byron. So another question for Cheryl this time. If the second dose had to be given after 21 days, what happens if we are now to get the second dose after 3 months or 4 months? Are we not put into some kind of danger?
Well, before they made that decision, they they did have some scientific review, or there was a scientific, very rigorous scientific process before they arrived at that to that decision. So um, right right now, many people have received their second dose significantly after the 21 days, right? And there was no um, uh, reactions, but any negative reactions at all. And yeah, so the main concern was that it would decrease the efficacy of the vaccine, but according to the data that they've gathered, it is still effective, even if it exceeded the interval recommended by the manufacturer. And the 21 days is actually the minimum interval. There's no maximum at all. The vaccine hasn't been available long enough to see any maximum interval between the two doses. I don't know if that answers your question.
Okay. Anyway, if there's any follow-up on that, we'll get it. So another question for Byron. What do you suggest that migrant workers advocates could actually do in order to push for the agenda for more access for undocumented and more marginalized migrant workers?
Thank you. I think that the issue has been present in the media. Unfortunately, the health authorities are not responding right now to that specific need. I really think that we should get together, the different migrant rights group, and we should definitely go directly to the medical health officer and explain why we are requesting these specialized clinics. And why are we requesting these specialized clinics is because we need to create an environment that people feel safe, access without fear, that the information will not be shared with anyone, and also in terms of being the service being provided in the language of the communities. Then we are talking about undocumented workers. We are talking about other people with precarious immigration status. We are talking about the LGTB communities that need also some safe space. We are talking about also sex workers from other countries that are working here who need a safer place for the vaccination. We need to come together, and I think that's possible too. If we come together, we should be able to request a meeting with Dr. Henry.
Oh, that's good. And maybe Sanctuary Health can facilitate that, right?
Yeah, I think so. It will be nice to do it.
Okay. So, are there any other questions? I've run out of questions from the list. Are there other questions that anyone would ask? Actually, any participant can unmute and ask in person if they want to. So, if there's anyone, okay.
Can I say something?
Yep. Go ahead.
Also, I forgot to mention that in terms of the Latino community.
Hold on. Hold on. Anyone who is not who is not talking, please unmute. Okay. Okay, Byron, go on.
Based on our experience with the Latino community, and especially with people with vulnerable or precarious immigration status, when they got COVID or they call us and they say, I got COVID, I don't have any support from the government, then I had to isolate myself. Then they call us and we have a system where we deliver food to those families that have to isolate themselves, and if they don't have any economical support from the government, at least we support them with the food part. And also we bring to them a kit that has a thermometer, oximeter, some of the supplements that they need during the time that they have to be isolated. And also we ask them to call us if they need someone to advocate or translate for them when they need to call the physician or the nurse. And we have been doing that with our community, and like every week we have new phone calls from people that got infected working in a construction site, on a janitorial site. And if anything like this happens with the Filipino community, please let us know. We will be happy to support also people from the Filipino community who get affected by COVID, and if they need food, if they need the kit with the thermometer, the oximeter, if they need some support, let us know. We will support you if you need food. We will bring anything that you need during those days of isolation.
Thank you very much, Byron. One pahabol question here. There's a question for, I think it's for Byron. Are vaccines free in BC for international students?
At this time, no one has been charged for the vaccine. No one that I know. And I know international students who have been requesting their vaccine through the system, and there is no charge. And many of the international students have MSP. Others, they don't have MSP. If they don't have MSP, they can say, I don't have MSP yet, and they will be seeing anyways. No one has been charged for the vaccine. I've seen some people being charged for the COVID test, but not for the vaccine. Mhm.
Okay, that clarifies things.
Mhm.
Are there any other questions from the participating audience right now? Do you have anything, Christy, from the Facebook chat?
No, there hasn't been any questions.
Okay, so maybe it's time for us to wrap up. Uh, First, I would like to thank everyone who has participated. I'd like to thank the two speakers, Byron Cruz of Sanctuary Health, as well as uh, Sheryl Anne Montano from Quebec, uh, who have actually clarified a lot of questions. Now, uh, we're ending the question and answer portion right now, but if you have any pahabol questions that you would like to ask after this webinar, we will be flashing our email address at the end. So if you can still stay till the end, we will be flashing our email address to which you can direct post webinar questions. Again, thank you to participants and to FB viewers. Thank you for the speakers and for the very informative session. And I sincerely hope now that the listeners are now convinced that the vaccines are reasonably safe and should therefore be accessed by everyone except in exceptional cases of contraindications. And I hope that all our migrant workers working under precarious and even legally questionable circumstances should by now understand that they do have access to the vaccines, and we should advocate for that. Everyone should help this our brothers and sisters who are undocumented to access and know that there are organizations out there like Sanctuary Health, Migrant BC, who are out there willing to help them get access. So right now, uh, I, for one, have been vaccinated and have not experienced any untoward symptoms. And as a medical health professional and as a certified medical director here in Canada, I personally encourage all my family members and all my friends to get vaccinated. And I believe all of you are my friends. Thank you. So, abangan ang susunod na programa sa seryeng Abot Kamay. Please visit our FB page in Migrante BC. Okay? Everyone take care and thank you very much.